So today's topic is very exciting. It's how we manage sports injuries of the knee. Now, sports, we all know, has a long-lasting benefits for our health, which is why it's extremely important that we manage sports injuries in a timely fashion and also manage it well. A wide variety of sports can give rise to injuries. This may be contact sports like football or hockey, kabaddi, or it could be non-contact injuries, for example, badminton or hockey. So these sports can result in injuries, but many other sports, can lead to variety of injuries, and knee injuries are extremely common. In terms of the age group that it affects, sports injuries can affect anyone. Let's say a child who is 7 years old can have a sports injury of the knee, or someone in the 70s who's active can also suffer a knee injury. Majority of the knee injuries that we see, they can be treated without any surgery. Majority of the injuries, they can be treated either with rest and rehabilitation program, but about 30 to 40% of them eventually need some kind of intervention in the form of surgery. Now, in terms of the variety of injuries, we can see minor injuries like sprains, or we could see significant injuries like tears of the meniscus or injuries to the ligaments. It could be dislocations of the kneecap or even fractures. Now, what are the symptoms of knee injuries? Now, commonly if you injure your knee, what we see immediately is pain, some amount of swelling, and you could feel that the knee is a bit stiff. There are some symptoms that to put weight on the leg. If you are not able to straighten your knee completely, if the knee is buckling or if the knee is giving way, this may indicate that the injury may be fairly serious. How does one provide immediate treatment, during a knee injury? So the first thing, let's say you are in the middle of a game and you've injured your knee and you're struggling to continue. The best thing would be to stop playing. Give it 24 to 48 hours of rest. Secondly, you could apply ice. Icing the knee is excellent treatment. It reduces the swelling, reduces pain, and also reduces the inflammation. And this can be done for about 10 to 15 minutes at a time, every 2 hours. If you have an elastic compression bandage, you could apply it. That reduces swelling as well. And to some extent, as far as possible, keep the leg elevated. Obviously, if the symptoms persist, it's best to seek expert treatment. If we have a look at some specific injuries inside the knee, if we have a look at this bone model here, so once we take the kneecap off, what you can see is a few structures inside. You've got the blue structure. This is called the meniscus. Now the meniscus is made of fibrous tissue and cartilage tissues. Now these can be prone to getting injured in sports injuries. Now meniscal tears are also associated when large amount of force goes across the knee, and this is quite common, particularly if somebody is overweight or obese. Meniscal tears are often a condition called discoid meniscus. These are prone to being torn or injured easily. Poor alignment of the lower limb. This can lead to injuries. Also, if your job is quite physical, if you are actually a professional sportsman, or if you are maybe in the army, these are situations where meniscal tears can be quite common. Another situation where you may come across meniscal tears is in old age. In the old age, meniscal tears may be a part of osteoarthritis. In these situations, the meniscal tears may not need surgical intervention per se. In young patients, meniscal tears, we advise that the meniscal tears are always repaired. Meniscus has important functions. Now the meniscus helps with transmission of large amount of forces and also helps with stability of the knee. Now once a meniscus is torn, these functions are affected, and it's quite important that in young patients these are repaired well. In older patients, if the meniscus tear is causing mechanical symptoms, like if it is blocking your extension or flexion of the knee, then it may be reasonable to consider a keyhole procedure to improve the symptoms. Moving on, if you have a look at the model again, if you closely see here, now this is one of the popular ligaments because it's quite commonly injured. This is called the anterior cruciate ligament, ACL in short. Now anterior cruciate ligaments can commonly be injured during sport. The role of anterior cruciate ligament in the knee function is that it provides stability to the knee. It's one of the 4 important ligaments of the knee. Now once you have an anterior cruciate ligament tear, the question arises whether your knee is able to cope without an ACL, or is it something that's giving you symptoms. A decision whether you are able to cope or not should be taken at the end of a good rehabilitation program. Now this will tell us whether your functional demands are able to cope without an ACL. Now the number of patients who are generally able to cope without an ACL is about 15%. Among them, a small percentage of them actually come back to the hospital with meniscal tears within 1 year. The vast majority of ACL tears generally lead to symptoms of instability. Now, in patients who are high demand, who have functional instability, it is very reasonable to consider an ACL reconstruction. This is a procedure which has excellent functional outcomes, and when it is executed well, this has the ability to put you back into your sport at your previous level. Now, in terms of prevention of knee injuries, if you are playing sports for a club or if you play regularly in a group, it's quite important that in the off season you focus on a strengthening program. There could be programs that are designed for off-season strengthening and injury prevention. So it's quite important that you focus on, if you're planning to prevent knee injuries, then the muscles of your core strength, muscles for core strength, your leg muscles, your thigh muscles are important. And it's quite important that you work on them throughout the off-season. This can reduce the chances of knee injuries during your sports season. Secondly, warm-ups. Warm-ups now is extremely sport specific. So in terms of preventing knee injuries, your warm-ups should include a variety of things. These may include proprioception training, balance, strength of your thigh muscles, the inner thigh, which is called the thigh adductors, the hip adductors, muscles of your foot, exercises that allow a dynamic stretching. So all these kind of exercises during your warm-up will to some extent help you in preventing injuries of the ligaments and the meniscus. I hope this talk was useful. We'll see if there are any questions, and we'll take some questions. Okay, so we have a question here. This patient has some pain after an ACL, which is 2 years old and unable to get to sport. Now, ACL reconstruction is quite commonly performed procedure. In the past, the failure rate of the graft for ACL used to be around 10 to 15% among elite athletes, where athletes really test the graft. Whereas nowadays the techniques are well refined and the success rate is over 95%. However, ACL reconstructions can fail. If there is instability following surgery and a rehab program, despite 1 year of rehab, then we can investigate as to why the ACL has failed. Most often, ACL reconstructions can fail either due to poor biological features of the patient or due to technical errors. These ACL failures can be revised and a new graft can be placed, and the patients can successfully go back to sports. It's another patient here. There's another question here. So knee pain while trying to sit down and stand up. So knee pain usually when patients try to stand up from a sitting position or if they are squatting, it's quite common that the front of the knee is affected. So the area behind the kneecap. So the area behind the kneecap, this is called the patellofemoral joint. Now this is a pain generator in about 30% of knee problems. Extremely common to have cartilage issues behind the kneecap and in the groove where the kneecap sits. So it's quite easy to investigate this area and also to look at the overall alignment to see how the kneecap is tracking. So that may be a usual cause of knee pain, and this can be generally treated easily with a good rehab program, and depending on other factors that the patient has, further treatment can be instituted. So it's another question here, what care should we take after ACL surgery? It's quite often that we see that patients neglect rehab programs after ACL surgery. See, the ACL ligament relies on a graft that needs to heal. So the ligament needs to heal to bone. So this takes time. So the time that the new ligament takes to gain strength comparable to the other side can take up to 12 months. So that's how long it takes for patients to return to their normal sport. So returning to sport early may be possible, but it obviously carries some risks of graft failure. So in terms of care after ACL surgery, I would say that follow the rehab regime and do not rush back into sports. That's what I would recommend. I think we're almost done here. Thanks a lot for joining us. I hope you enjoyed the talk. This talk is going to be present on the Apollo Spectra website, so feel free to watch it and also share it with your friends. Thank you.